So welcome everyone to this morning's RPS GlomCon session. We have today Dr. Kuang-Yu Jen, and so as he's giving his talk, please feel free to enter your questions within the chat. And in the last bit of the time, we'll go through and we'll get to everybody's questions. And so Dr. Kuang-Yu Jen is Professor of Clinical Pathology and the Director of Renal Pathology at the University of California, Davis.
Great, thank you, Mei Lin. Thanks for that introduction, and thanks everyone for spending the time with us this morning, or at least the morning in California. I'd like to thank the organizers for inviting me to give this talk. Let's see, go to advanced. There we go. These are my disclosures briefly, and so today, obviously computational pathology, and more specifically computational renal pathology is a rapidly growing field, and there's a lot in the literature right now. So that's basically impossible to cover all that within this hour. So instead, I'm going to kind of give you some basics and talk a little bit about the projects that I've been associated with. I'm a practicing renal pathologist. I don't have any special talents besides that. I'm not a computer programmer. I'm not a computer scientist. I'm not an engineer, but I've had the fortune to work with a lot of talented and very smart individuals in those fields. And so, I'll be presenting some of that work today. So the outline is basically, I'm going to talk about a little bit background about what is computational pathology and digital pathology. Go into a very basic technique called image segmentation, which is kind of foundational in terms of image analysis and computer vision, and then talk about applying that image segmentation and computational pathology to address specific tasks, such as automation of specific tasks in renal pathology, morphometric analysis, and hopefully we'll have some time to cover virtual special stains, which is a pretty exciting topic. I think something that's kind of being developed to the extent that it may be something that may be implemented in the near future. All right, so what is computational pathology? Well, this paper from a few years back from the Digital Pathology Association, has some definitions in this paper, and in this paper I quote this paper saying that computational pathology is a branch of pathology that involves computational analysis of a broad array of methods to analyze patient specimens for the study of disease. So a very broad definition, but more specifically in this paper they talk about extraction of information from digitized pathology images in combination with their associated metadata, typically using AI methods such as deep learning. So this is really what we're talking about here, which is essentially we're going to use digital pathology, meaning we're going to, first of all, as you guys are probably all familiar with, that tissue right now, it's not an instantaneous process. We take the biopsy, and it has to go through many steps of processing and embedding and cutting and staining until we arrive at the microscope slide that the pathologist can use to make a diagnosis. But now we have to have an additional step of digitizing these slides so that the information can be used for computational analysis. All right, there is a field looking at going from tissue straight to digitized images, but I'm not going to cover that today. But that's a pretty exciting field. That way, it would bypass all the necessary steps that currently we would need to produce digitized images. So, what are the obvious advantages of digital pathology? Well, a lot of this, I'm not going to read through these, but a lot of it has to do with the advantages of digital media, which is essentially the ability to share information throughout the world. And, it really becomes a location independent material that everybody can take advantage of in diagnostics, logistics, teaching, and research. But the main thing I want to highlight here is that